Okay, everybody, welcome back to your Crisis Coach with Scott H. Silverman and myself, Fred Carroll. How are you today, Mr. Scott?
I am well, Fred. I have a week of activities I'm not excited about. So, otherwise doing good. My youngest is flying in from New York. She'll be here tomorrow night for a couple of days working, and then we're going to just hang out for a couple of days. So I'm looking forward to that. And my oldest is having a birthday on next Monday. So, it's kind of an exciting time, I guess. Cinco de Mayo's over, and, we're just living one day at a time as best we can.
Well, that's
How about
great.
you?
I'm fine, same stuff. Kids are visiting. They come in, they leave. You know, what I realized is now with the technology we have with Zoom and stuff, even though I haven't, and I know this is from a father's point of view versus a mother's point of view, and we'll get to Angie soon. She'll talk about that. But from a father's point of view, I always felt we don't need to physically see our children as much as a mother would like to physically see their children. But just being able to see them on Zoom, I forgot that I haven't seen them in a year and a half, physically. A year and a half is a long time. A mother would go nuts. And I don't want to put them in a box, but that's just from my experience that mothers tend to need more, I guess, the hug, the physical side of their children versus me. They know my credit card number and I know they're alive when it's being used.
That's a special thought, Fred.
Yeah. Isn't that special?
You can get alerts now when they use your card, so you get an email immediately. My daughter, we have what we call a special family plan for certain things, and when I call her and she goes, "Oh, I was going to let you know that I was going to," I said, "Well, the alerts come faster than your phone call, so heads up with you."
I said. I told them the credit card's an emergency credit card. All my kids are aware of its limits and that it's open to them at any time. The problem is only one of my kids seems to have an emergency every week. And he's the one visiting. Of course, now. And I asked him, I said, how come your sister never has an emergency? All my emergencies are in Utah, but none of them are ever in Connecticut. They're never out down in Georgia. And it's just him. And literally it is. I looked back over the last 6 months. He's the only one that's used his credit card. And it's for concert tickets, going on vacation, not emergency.
Yeah. So let me ask you this then, to get personal for a second. Is an emergency visit to get your eyebrows done? Because that's classified somehow as an emergency in my daughter's world because, I hadn't thought of it and I forgot my card, but I had yours. I go, that sounds like an emergency. It
is an emergency. Let me tell you, as a girl dad, the beauty part of their life is a major emergency. It trumps almost everything, including funerals. If there's a hair appointment, they keep the hair appointment. And I support that only for one reason, because one time I didn't support it. And I think I got yelled at for about 3 weeks. So I've learned and adapted that she wears the crown, not me. So let's get to your guest today, Miss Angie Ferguson. Tell us about your guest.
Well, Angie has been stalking me now on social media for so long, and I've been begging her to communicate with me. And I think, Angie, didn't we have a Zoom last year? Just briefly, I thought we did, because if you can't remember, there's no way I'm going to remember. But Angie does some very interesting work, and I want her to talk about it. And I hear about her through a third party, our buddy Larry Kenmore. And I'm hoping that you'll share with us, Angie, who you are, what you do, why you do it, and so we can get to know you better. And as far as I know, Fred, everything I'm going to hear today, I have a kind of a global understanding of what she does, but I want to hear the details and why you're doing it and what your outcomes look like and why it's important, because I think what you're doing is really, really unique. And that's what really brings you here. That's why we flew her in from her, living room to her studio. We have a very low budget. So, Angie, the mic's all yours. Tell us who you are and what you're doing and why you think you're here, and we'll correct you if you're Incorrect.
All right. Well, that was an interesting first few minutes as a girl mom and a girl myself. That was very interesting. And you're right. The hair appointment, those take months. I don't know about the eyebrow thing. I think you can get that done. I tell my daughters, yeah, you have my credit card for emergency, but you also have Venmo, and that works both ways. So that's how that goes. Yeah, so I am actually in Cincinnati, Ohio, and I've been working with Drug Free Clubs of America in October this year. This is our 20th anniversary, and I've been here since the very, very beginning. So I'm an open book as far as our prevention strategy. It hasn't always been an easy road because we do things pretty differently than a lot of prevention organizations. But I am happy to peel back the curtain and answer anything that is, curious to you, and we can get into it.
So share the mission, and elaborate on that, because I think it is called Drug Free Club. You say it. I want to get it right. The name of the organ.
Clubs plural. Yeah, Drug Free Clubs of America, because each school that hosts a chapter of our program is its own club. So we are Drug Free Clubs of America.
So let me back you way up. What is Drug Free Clubs of America? What is that organization, and what's its mission?
Okay, so we actually started it here in Cincinnati, and what happened was my father is a Cincinnati firefighter, a retired Cincinnati firefighter. He was in the firehouse with another firefighter, and they had just a horrific day. They had actually lost a 15-year-old on a run, and they were just beside themselves, just frustrated at the amount of time and energy and money that goes into the rehabilitative side of things, but not enough goes into prevention and stopping it from happening in the first place. They were thinking like firefighters think, prevent the forest fire, prevent the addiction from happening in the first place. So they started digging into what could be done and realized that drug testing as a mechanism for prevention works every single day in corporate America for our bus drivers, for our pilots, for our police officers, our firefighters. They all have to pass drug screens. My husband is a union plumber, but he has to pass a drug screen to keep his license. So they thought that works to encourage people to stay drug free. But how do we apply it to the teen mentality and make it fun and something they want to do without punishments associated? So that's when they came up with the model of keeping it voluntary, attaching rewards to it. They thought if we can give them the opportunity to be drug tested, and that becomes their safety net when they're in a drug related situation, they can say, I can't because I get tested. But then they also get all this positive reinforcement and rewards to encourage that to continue. And it also sort of continues to support their out. So they can say, oh, I'm in drug free clubs because I get the free pizza, or I get out of class 5 minutes early to get my car out of the parking lot, or I jump to the front of the lunch line on chicken nugget day, whatever it is that our student officers come up with. So all positive reinforcement, all voluntary, and our drug test results do not go to the school. They go just to parents. So there's no risk of stigma. There's no risk of labels happening where it's so hard to get away from that once it sort of attaches itself to a young person. So really that's the basis of it. Then we pad that with support for parents when they get concerning drug testing results. And then the whole year round, we do education so that if there's a moment where a young person might have the ability to influence a friend and say, hey, did you know? Or whatever it is, we just completely continue to help students understand the reasons behind why do we choose to stay drug free.
So the idea, what's your demographic? What's the age of the kids that you work with, or you ideally would like to work with?
Our program itself goes from 6th to 12th grade. And I would say probably about 85% of our members, if not more, maybe closer to 90% of our members are actually in high school. And that's pretty counterintuitive to prevention in general. So sometimes that throws people off a little bit, but the reality is when you are putting together a program that you want to be desired by teenagers, that you want them to want it, and that's what really feeds the behavioral model behind it, which we can get into the science of that if you want, but they have to want it in order for it to sustain that drug-free choice once they graduate from high school. That only happens if it's voluntary, and that can only happen when the young ones see it more as a rite of passage, as opposed to the older ones seeing it as something that the babies do. So even though the age of first use is typically well before high school, or age that they are getting their first offer is well before high school, it has to first get the reputation as something they want to do and they're excited about it. So the majority of our members are in high school, and then we add on the middle school after that gets launched.
So, what percentage of the kids that you serve, let's say 100 kids in a junior high school class, 100 kids, how many would be involved with your clubs? Normally, what percentage are you able to introduce, convert, engage, to bring around, to get them to sign up? What does that look like?
Yeah, that's one of the most exciting things about the program, because traditionally drug prevention clubs like this have struggled to gain membership. If you think about some of the groups, like when I was in school, the group that would do something like this was typically just a core select few students. This year, each year it has gone up. This year we grew to 24.4%. We just did those numbers the other day. So we've got about a quarter of the student body who are in the program. Now that is across over 50 schools in Ohio, Kentucky, West Virginia, and California. So there are some of our schools in, have you read Dreamland, the book Dreamland? Okay, so that area where that book is based is one of our strongest areas now. They will, in some of their schools, they've got 80 and 90% participation. And then you've got other schools that are just getting off the ground. They're starting to spread the word about it. Those are lower percentages. But if you take everything and average it, we're at 24.4%.
So that's remarkable, by the way. Even alumni associations, with the big schools, don't have that kind of participation. So, what are the larger percentage? What kind of pushback, feedback, barriers, resistance? What are they saying about the 24%, or what are they saying about the clubs themselves, or why they don't want to get involved? I'm sure you've got some research. You guys have been around a while. What is what's keeping them from joining in?
You mean the students who choose not to do it? Why do they choose not to?
Correct.
Yeah. So I would say, like a lot of things in schools, a good portion of it is simply just the awareness of getting it out there. Because it seems like the larger the school is, the harder it is to grow that percentage, just by sheer numbers themselves. But then also just word of mouth to get that to travel is harder. So, just like anything, a challenge is having really effective marketing. And our schools that really engage student ambassadors as the ones who design their program and market their program, they have the best percentages because the students talk about it. There's nothing better than word of mouth, right? Especially when the details of your club are being designed by your classmates. So they're going to talk about that. Hey, did you know that we get to get out of class early, or we get a prom ticket discount, things like that. So, number one, I would say the biggest challenge is making sure that the word gets spread. And it is a medical procedure to do a drug test. So, getting the permission slip back to do that drug test, having it signed by parents as well as students. So, just sheer logistics are a challenge sometimes. As far as the strategy itself, Sometimes people may be apprehensive about if they take prescription medication, for example. Like my daughter takes ADHD medication. And she may be apprehensive if she's like, I don't know how I'm going to be treated if my test looks positive. How I take, an amphetamine, how is that going to come up? So there might be a little bit of that until they really hear from the other students that, hey, it was easy. Everybody got treated exactly the same. There's no awkwardness when there is a prescription involved. We've got a whole separate process for that outside of the school environment. So it really just takes some time for that to spread. Those are probably the biggest things. The two biggest things is apprehension about prescription medication and just getting the word out.
Well, based on
So
data, that's another 25% right there of kids that are taking some form of medication already. So that addresses 50%. Do you do anything? Is anything happening in Southern California that I might have heard about or seen that you're aware of?
So we are at the infancy stages of our work in California. Right now, we've got a club in Fresno at Clovis in that area. That we've got a great partnership with CASWA. It's CASCWA, which is kind of a clunky acronym. But it's a fabulous organization if you're not aware of it. They are a support system for anybody who works in education but is not an educator. They're not a teacher. So school counselors, just family resource centers, any kinds of those personalities inside of schools. We've gone to their conferences a few times, had wonderful conversations with schools. So the schools we were able to launch from there are in the Fresno area from our conference last year, 2 years ago. This year, we are talking to a school district, and I won't say their name just because if it doesn't go through, I don't want to, set off any alarms or anything. So, but we are very close to launching a little bit more north of the Fresno area. So I'm excited about that.
Got it.
so with this, so I got a few questions here. With this program, obviously you're always dealing, there's everybody's different. Parents parent different, teachers teach different, children act different as they age or change, for good and bad. So let's say a kid does fail a test. What happens then?
If our model is very different than most other drug testing models. So I'll tell you how ours works. We have staff that communicates with parents directly. In a lot of other programs, some of the biggest pushback you get is because the school gets involved and there is this really challenging conversation. There's punitive measures associated with it. We don't do any of that. In drug-free clubs, the sample goes to the lab. The lab does an analysis of what's found. That lab report goes to our doctor, and then the doctor has a conversation directly with the parent. So there's no school involved in that. And even in the verbiage, remember I was talking about the parent needing to sign the consent form? That's HIPAA verbiage where if we were to release that drug testing information to the school or anybody else, we would be violating HIPAA. So that's some added assurance that parents have that this is just between us and them. And I cannot tell you how many times I've had conversations with parents. Immediately, the first thing is we tell them that there's a positive drug screen. And the first thing is, who knows? It's not how dangerous is it? It's not how much anything like that. It's who knows. And when you can remove that from the equation and say, look, this is just between the doctor, you, and us at Drug Free Clubs. We've got a school counselor on staff who follows up and has conversations with the parents and even if with the student if they'd like to talk. When you can take that risk of stigma out of the equation or the damage to the reputation and just focus on it from a health perspective, the whole vibe of the conversation changes when they say, okay, that's when they start to be nervous about the health of their child and the danger of the experimentation. And we can have a conversation about getting them back on a healthy path. But that's how the reveal process, so to speak, works. And then when the parent is ready for the student to retest, we simply put our in our system that this person is ready for a retest. At the school, they just click a button to generate a list of students to be tested. And those are people randomly selected. Anybody who's there for a retest will be just fed into that list. So the school has no idea that anybody is getting a retest. To them, it just looks like randoms. And then we can follow up with the parents and let them know the test results, get them any kind of resources they need, things like that.
Excellent. Yeah, I would guess that parents, just from being one and experiencing other parents, a lot of times were embarrassed, more worrying about how people are going to view us because we get blamed for every part of that child. And we're, whether it's some breaking the law, and we try to keep it hush hush, everything's hidden in hush hush. So that's why I was thinking of that. What about on the legality side? I don't know what the laws are in Ohio. Is marijuana legal?
Yes. Not for under age 18,
Right.
so it's never going to be legal for our young people, 6th through 12th grade. And even if it is, this is all about, legal or not, this is all about them having the opportunity to make a fully informed choice about whether or not they're going to use. Right now, they are inundated with all of the propaganda, billions and billions of dollars of advertising, slanted opinions, inaccurate data that is driving their decision making. And we are like a whisper compared to the exposure they get for the pro-drug side. But at least we're a whisper and we can get that word out there. And when you can hold a megaphone to that by engaging their community, their school, and their family and their peers around that messaging, that makes a massive difference when somebody is making a decision. The research that's been done on us has also shown, because of the visible nature of being in drug-free clubs. And when I say that, it's when the students go to the front of the lunch line on Chicken Nugget Day, for example. You can see those students going to the front of the lunch line, so you know they're in drug-free clubs. It's a positive thing and it's a fun thing, but it's a visual cue that those students are not using. And as many times as we can make being drug-free a visible choice, then more people who might be on the fence can see that and maybe will go towards that side because they'll know they're not alone. So really what we do is we change the perception that everybody's using, and they start to see how many people are not using. For the first time, they can see non-use, which is a very unique thing. So regardless if it's legal or not legal, we just want to turn up the volume on the information about keeping yourself healthy and knowing you will not be shunned in your choice to stay drug-free because all of these other kids are doing that.
Yeah. So from this perspective, maybe you could answer this, and I know Scott can, and he has a different story. But what's your recommendation to being honest with your children, and whether you are, I am, and I happen to be? I know Scott doesn't have a choice. His family, he does this for a living, so his daughters are aware that he was an addict. What do you recommend a parent tell their story to a child?
Scott, I'll let you talk about that because your story is a little bit different, and I'd love to hear a little bit more about how you handle that. But all of the research that I've read, everything that I've seen says be honest about it. Because when you are dealing with teenagers, they have a unique ability to see through baloney, right? They can they can test, they can see a lie a mile away. They don't get enough credit, these teens. And that's probably the most fun part about my job, is being able to give credit where credit is due. What they face in an everyday scenario is just phenomenal, and the way that they handle themselves in a lot of cases just deserves more applause. So I think it's worth being honest with your student. But as a parent, I'll never judge somebody on how they handle that, as long as they are coming at it from a place where they are promoting the child to make an informed decision and stay drug free for the health of their brain, for the health of their future. And all of this hard work they're putting into their education and their extracurriculars and building up their applications for jobs, military or college, whatever it is. Have that conversation. For us, when we do our education that goes out every month and every day on socials, our education goes to the parents, to our community partners, as well as to the students. And all three of them are written in different voices. It's not the same thing that goes to each person. So parents have a lot of misinformation also. They think that, you know, originally there was so much hype about vaping being a safe way to quit smoking, and it's just water, how harmful can it be? And that marijuana is natural, it's a plant, like all of these things that we say to ourselves to make us rationalize. So we also educate the parents so they can continue to have conversations in a way that maybe they don't have to tell their story. They can focus on the facts of what they want for their child. But Scott, with you, when you first had this conversation with your kids about it, and telling your substance use disorder story, how did you approach that?
Well, my story's a little bit unique because they took my kid. My kids never saw me loaded. They never saw me high. They never saw me drunk. So it was kind of easy. I would just bring them to my AA meetings. So they kind of grew up on it and they knew they had a choice. And that's what I talk to parents about. But when parents usually call me, that's usually when a child is kind of, didn't join your club, isn't even part of the other 64%. They're the 15% that may be predisposed to the disease of addiction, or they're already self-medicating and have been, or they have an older sibling who they're trying to emulate. So it's a tough conversation, but I think to answer your question, Fred, anytime you could sit with a child and I shouldn't say that. Anytime you can sit with one of your children, it doesn't matter what their age is, because the information highway, what I knew at 12, kids know today at 3. And if they have siblings, maybe even as early as 2. And, we've seen accidental overdoses take place because Junior wanted to do what his older brother did. So there's that emulation as well. So the club idea, I think, is really interesting. And I think from a prevention, it's unique. So I want to ask you, Angie, how do you introduce this to the school? Does your team go in? Do you start with a teacher, principal, the PTA? How is this originated, as far as getting the school on board with it? Because, just like watching this evolution in the last decade with the opioid crisis and fentanyl and trying to get Narcan in the schools, how resistant schools are to bring, teachers are already busy. They already have a full curriculum. They have at least in California, that the ratio of teacher to student is so high, they don't even have time to take a break except to go buy pencils now with the budget cuts. So what is it you do that's unique to get the information into the school? And I feel kind of stupid. I've been in the prevention business for decades. I've been in recovery for 40 years. I really don't know about your organization enough, other than what I've read and learned from, Larry. So how, I want to talk about how I can help at some point, not today, but how is that possible that you've got a tool like this that's got that kind of percentage of participation, and why it's working? So how do you introduce it? What's your first step with a school that may or may not know who you are or have heard about you? How do you go about that?
Well, as you alluded to, every school district is different, every school is different, and the structure varies greatly. Sometimes the decision maker is the principal, sometimes it's the board, sometimes it needs board approval because it involves drug testing, other times it's viewed as a club, and clubs don't require board approval. So typically you start with where you are. And when I say that, I mean, who do you know at the school that you can communicate this idea to? And then ask that person, hey, who would be the best person that would make a decision about this? And you go from there. So when you talked about Larry, the concept that there with Rotary is that Drug Free Clubs by Rotary is a project that Rotarians can bring to their local club. And they would start by asking inside of their club, hey, who do we know in the local high school? How's our relationship with that person? And then you ultimately want to get the information to the principal. If we're just sort of cold calling on a school to let them know about this opportunity, we usually start with a personal counselor, the school counselor who may not ultimately be the person who runs it because they have so much on their plate, but they're going to know who would be somebody to make a decision about this, that person or the principal. Usually it's the principal that will say, okay, yep, I'm good with this happening, or this just isn't going to work in my school district. Sometimes there has been recently a ton of change in the building and they're not ready to add one more program on. Other times they may have recently experienced a tragedy, or they had a conversation where they didn't realize how prevalent use was in their students, but maybe there was a survey and now they're realizing, oh, we really have to do something.
Yeah.
What I'm shocked about is how few schools have any type of prevention. There's so many. It's such an influential environment, but in honesty, it shouldn't just rest at the doorstep of the schools. With this topic, it affects the homes and the communities and everybody else just as much. So it's a bit unfair that it has to happen in the school environment, but that is such an influential environment where if we can take that and make it a positive conversation about staying drug free, and we do that by engaging the student ambassadors. If we can do that, that's one of the most influential environments for them to make that decision. So
Okay.
I'd say start with the principal. You can talk to a board member if you know a board member. And with the Rotary clubs, they'll probably just think about who do we have connections with, and let's talk to that person. Ultimately, there's an agreement and it needs to be signed by the decision makers of the building. And they have to be comfortable with, the testing process and the confidentiality of that. Fred, you asked before about legality. And I will say, in the 20 years that we've been doing this, our process has been vetted over and over and over again. And when I say that, one of the main components when you establish a club is to partner with a local hospital or a medical entity where they donate the time of nurses or something of the like, just to come and collect the samples. We provide all the supplies, we pay the lab, we pay the doctor, the process we talked about before. But we can't be there to actually collect the sample. In that process of getting a medical entity involved, their attorneys, you can bet, they vet our stuff step by step. And the whole drug testing field is governed by the Department of Transportation, if you think about bus drivers and pilots being tested. So we follow DOT as closely as possible with a few tweaks for the school environment. But, Cleveland Clinic has been through all of our stuff. We've partnered with Cleveland Clinic, Children's Hospital in Akron. So there's law teams that have gone through our stuff legally, step by step, and have put that stamp of approval on there. And we've had long-lasting relationships.
So, question for you: how many states are you in now?
4: Ohio, Kentucky, West Virginia, and California. And then I think within Rotary, I think Larry is talking to 5 additional states.
Okay. So, I'm on that board with Larry. I'm somebody who wants to put myself out of business. I run a treatment center as well, and I'm also an interventionist. And if you're effective, I can retire and not have to worry, because with the overdose rate so high and the morbidity rate being so high, and a lot of it's accidental overdosing. And that's a kid somewhere at an environment where someone says, oh, here's a Xanax I got out of my mom's, pill mill or pill box, and I'm going to take one. Would you like one? And it's laced with fentanyl. 95% of illicit drugs now, at least in our region, are laced with fentanyl. So one pill can kill. So to be able to have an option like that, and do you know Rocky Heron? Have you met Rocky? Have you heard of Rocky?
Yes, I've
Yeah.
heard of. Yeah, we haven't had a conversation directly with just us, but of course, being in this space, Rocky Heron,
Well, he just
especially in
hits
the
two.
California area, right?
Well, he travels all over the country in Mexico, and he's going global now. But he's talked to over 250,000 kids, and I know that if Larry and the team want to be effective and eradicate the opioid crisis, a big portion of it's going to have to be prevention and education, because you look at the data, and even though the overdoses have slowed down, a lot of it's because of naloxone, and a lot of it's because the cartels finally realized they better dose down the illicit part of fentanyl, because a major part of the consumers are overdosing. So they've changed the way they're manufacturing fentanyl now. And, we're not going to stop it at the borders, because it comes through airplanes and UPS and FedEx and all kinds of, and it's a synthetic, and it can be made anywhere. So let me ask you another question, then I'll give it over to Fred, because I know we're running out of time. Is the overdose rate in your areas, have you been able to identify any impact that you've had on that you can identify?
That's a tricky one for prevention. So, because of exactly what you just said, if there's a drop in overdose death rates, it is automatically associated with the administering of naloxone, regardless if that's the case or not. If we were able to stop initiation in the first place, that is not going to hit the charts as much as, overdoses are down, so it must be naloxone. And that is not unfair, because those types of stats are what's going to drive people to really feel like they can make a difference on that topic. For us, when we are measuring if we are effective, and we've been through 3 rounds of independent research, I'm happy to share the data with you, as well as a behavioral model analysis. What we can see is that perception of risk. We know, and especially in young people, the more risky they think something is, the less likely they are to do it. Our data showed over a course of 5 years, the perception of how risky it is to vape, Adderall, marijuana, and take prescriptions other than what's prescribed, those 4 categories. In all 4 categories, we increased their thoughts about how risky it is, which decreases their likelihood to use. So perception of risk is a huge indicator of our success. We also asked the students about, hey, have you used this to help you stay drug-free? Let's call a spade a spade. Did it work? And in the first year, after completing 1 year, 58% of them, right away, 58% said, yes, I use this to help me stay drug-free. They use the word absolutely instead of maybe or yes or no or absolutely not. And then that increased over the course of 5 years, steady incline, increased up to 64%. Actually, it might have been 67%, but conservatively 64%. So we know, just by having it there, with every passing year, you have an increased number of students saying, I used this to help me stay drug-free. We get to a point where we've got students who, by their junior and senior year, they say, I almost don't like the rewards anymore, because it takes away from me standing up for it. And people think I'm just doing it for the free pizza, when really I'm doing it because I believe in it. And it's an interesting flip, when you start out freshman year saying I'm going to do it for the pizza, and by senior year you're like, I kind of don't even want the reward, because I just want to be proud that I'm doing this. And then you've got the students who maybe they did mess up, and maybe even before they got to our program, just because you used once doesn't mean that you are a user for the rest of your life. We don't label anybody. You can come back into the program at any time. We're going to work with you. Those students, there's so many of them have broken the trust of coaches and teachers and parents. And how do they earn that back? I mean, the amount of times that people don't believe you after you've been caught, so to speak, how do they earn that trust back? And when they choose to join drug-free clubs and they pass those drug screens, and their parents are beaming when we call them and say, this is awesome, that everything's good to go. So those are the types of things that indicate our success. I would love to take credit for the reduction in overdose deaths, but I don't think that's fair. And I think that that's reserved for the naloxone,
Yeah. Well, as
the
a
use of
quick
that.
footnote, according to CDC and the recovery community, substance abuse has not gone down, meaning it's more widespread. A lot of it's because of legalized marijuana, but so but the overdoses have gone down, but a lot of it's because people are like, I'm 19 years old and everybody knows somebody who's overdosed and died. And they're like, I'm not taking something. I don't know where it came from. So there's that evolution as well that's taking place. So naloxone gets a lot of credit, but I've seen a lot of failures with naloxone for people that don't call 911 or they don't have enough dosing on them to get to somebody and save their life. So there's a couple things there, but I think the trend of awareness, and kids are getting smarter. I mean, who wants to party at 19, after going through and then realizing, all of a sudden their life ends? That's an outcome that nobody seeks. I've never met anybody that says, I hope I overdose. I've never seen that. I've never seen anybody who says, I hope I can be a good drunk like my mom was. I've never seen that. So, and I've seen a lot of people under a lot of influence. Okay,
Well,
Fred, over to you, brother.
We've talked to numerous addicts and we've been through down this road where it's alarming to us, and I'm sure to you also, Angie, to hear that when a addict sees somebody died, their first question is, where did they get their stuff? Because it must be amazing. That's the addict mindset, is I can handle it. He couldn't handle it, but I could, and it must be amazing. And that's starting to die down. But I like the fear factor part of it. And I only say the fear factor part. It does work better. Maybe it's not the true solution, but it works better than the other. And what I mean is, when I was in school in the 70s, 80s, and they had that Say No to Drugs or that drug program, that even as a 10, 11, 12-year-old, I remember, the officer would come in, he'd show you the narcotics behind the glass and the simple things. But then they'd bring a guy out and they'd say, I'm going to bring you my friend Marty. He took 200 pills, did cocaine, did all this alcohol. And then Marty comes out and he's in a 3-piece suit. And as a kid, I'm going, wait, so drugs don't kill you? This guy did 200 pills, did cocaine, and drank all this alcohol. He's got a beautiful suit on. He's standing in front of me telling jokes and smiling. In my mind, it was, wait, Marty's fine. So what's the problem here?
Interesting.
And that's a child's mind. That's how a child's mind works. So I think it works. So my question is, outside of this program and outside of the norm, what does Angie do for fun? What is your fun life about when you're away from this?
Oh, I'm a pretty boring girl. I love to garden. I'm all scratched up from working in my garden. Um, I've got a close-knit group of friends that I hang out with quite a bit. On the west side of Cincinnati, where I live, we are a very rooted people. Not a lot of us leave, and we all have really close core groups. So we do our grill outs, we celebrate each other's birthdays. I had a graduation last weekend, graduation next weekend, graduation the following weekend. So, it's all about, for me, and much like a lot of people, it's all about that really core group and that peer support. I'm still really tight with all of my high school, well, with a majority of my high school girlfriends. You talked about Cinco de Mayo earlier. I had them over for dinner on Cinco de Mayo. So honestly, my close relationships are where I spend my time.
Great. What do you got, Scott, to finish this up? Anything?
No, it was really nice having you here. And one of the things I think I heard as a outcome of what you do is the kids have some pride and some, self-worth around being able to be informed and make a decision. And that's something you just don't hear about with young people today. And, I wanted to ask about what happened during COVID, but you and I will have a different conversation one day because I'm sure things shifted when kids were home more. But I think what you're doing is great. I applaud it. You've got my contact info. Let me know how I can be a resource. And thank you for what you're doing. And I think the word needs to get out there because it's a simple form of prevention and education, in my opinion. And because of the conversation, I'm sure the other 63 kids are, even though they're getting to the front of the line for chicken fingers and pizza, when you get to be a senior, you're probably a little more worried about it because of your waistline. But still, generally when kids get rewarded, other people feel bad and jealous. So this is one of those kind of things
Right.
that I think sends a message that, well, I want what they have. And, we, the people in the recovery community, we talk about, setting a different example in the fellowship. But, most in our fellowship, it's anonymity. Don't tell anyone. And I do it all the time and I get in trouble. So thanks for what you do. And thanks for being here today. So I look forward to a journey together to be a resource, not only to you and your team, but wherever else your journey takes you.
Yeah,
That's
and
it
we'll
for me,
talk
Fred.
again. We'll have her on again. What I wanted to say as I'm perusing the website, which is drugfreeclubs.com, I come across Angie Ferguson, executive director. The picture, the difference between what you look like in this picture to that picture, it's the haircut. It's the haircut.
My short hair, my long hair. Yes, yes.
And
My
you
hair
look
grows
like,
very fast.
and you are on a mission in this picture. I wouldn't mess with this girl. But actually,
Tell you
anybody,
that picture that you're looking at, that is that's a rally in Ross County, Ohio, where they have about 2,000 of the kids in that community are in drug-free clubs. And they get together on a Friday, they're all around each other, and that's the one and only year that adults spoke with the students. Now it's students that talk to students. And when you see them influence each other in that public setting, the adults are inspired. It is one I would love for you to come see it. It's every October. You could podcast from there. We've had that happen before. It is a beautiful, inspirational day. So anybody is welcome to come see that.
yes, I'll come when my Patriots are in town to beat up the Cincinnati Bengals. I will be there. And
Ain't
that's
gonna happen, Fred.
okay, everybody. This is your crisis coach with Scott H. Silverman and myself, Fred Carroll. And thank you, Angie, for joining us. And if nobody has told you they love you, we love you, and we will talk to you again soon. Hang out there for a moment.
Thanks.